Hello everyone, I'm Renee Mehrra and welcome to Your Health Matters, our innovative health series providing expert opinions on critical public health issues so we can maintain good health. Today I'm talking to Dr. Hemali Ajmera. I'm going to be talking about A to Z dentistry. And Dr. Ajmera comes with very good credentials. She's the chair of the New Dentist Committee of New York State Dental Association, as well as she's on the Board of Trustees of the Queens County Dental Society. And Dr. Ajmera is part of a family-owned practice that goes over 3 decades. Thank you so much for joining us on Your Health Matters today. Let's talk about the importance of dentistry, different phases of one's life, which is so very important.
Thanks, Renee, for having me today. As we know, the smile and dental health are so important. They affect one's confidence, they affect one's overall general health and well-being, and one's emotional and psychological state. And we know that more now than we ever did before. So I like to start talking about dentistry with pregnancy, because the mother is not only taking care of her own teeth, but also whatever goes into her mouth or whatever is in her mouth can affect her toddler. So I like to make sure that a mother who is pregnant is seen twice during her pregnancy for her dental cleanings, primarily seen in her second trimester for any x-rays or any dentistry that needs to be done. There are a lot of research studies that show that if there's oral infection going on, it can affect the baby. And it's very important that the pregnant mother is getting enough calcium and other vitamins. Her diet is good, and it's a well-balanced diet and a nutritious diet. Of course, there shouldn't be any smoking. We don't want any toxins going into the toddler, because we know at the 3-month mark is when the toddler's teeth start to form.
I see.
Very, very early on. So antibiotics, any other medications should always be cross-checked with the dentist and with the physician. Brushing and flossing, incredibly important for a pregnant mother. Once the pregnant mother gives birth, again, anything that touches the mom's mouth and then goes to the toddler can transfer germs to the toddler. So you want to continue to be careful, once even the baby is born, about what's going into your mouth and what kind of transfer is happening. Now, there are 3 types of foods, which I'll talk about more in our next segment, but you want to make sure as a pregnant mother and the mother of, a baby, that you're having cariostatic foods, or, foods that are not promoting bad bacteria to grow in your mouth. So you want to take in things like cheeses, nuts, green vegetables. Fruits are a healthy sugar. So again, you don't want those to sit on your teeth, but they're definitely better than processed sugar. And of course, any grains which you have that are processed, you want to be careful again to clean your mouth very properly afterwards, because they have been shown to expedite how quickly cavities can form in the mouth.
So every time you're eating something, it's better to rinse your mouth after that. It's much important.
Exactly.
To do that.
We like to have the mouth be pH balanced, and the way to do that is to wait about 20 to 30 minutes for your saliva to neutralize your mouth, and then to brush your teeth afterwards to kind of
What about rinsing your mouth without
reinstate.
brushing the teeth?
Absolutely advisable.
Okay.
And of course, you want to check with your local county or state to see if your tap water has fluoride or not, and if it doesn't, you want to make sure you're getting in fluoride tablets or fluoride toothpaste or any other adjunctive that you need to implement that. And so once the baby is born, a lot of parents feel lost. How do I take care of my toddler's gums, the teeth? What should we expect? So within the first year, the first set of baby teeth come into the mouth, and you see them right in the front of your mouth. And at the that early age, like 1-year-old, 1.5-year-old, you want to start seeing the dentist with the toddler to kind of get them into this good routine and get them comfortable in the dental environment. At home, the nursing mother should be wiping the gums with a wet cloth after just having the milk. Why? Because all of that sits in the mouth and can seep into the gums and really hurt the formation of good oral habits or the formation of healthy bacteria in the mouth. At the age of 1, you already want to start with the dental visits. You want to start brushing the teeth at home, but no toothpaste initially.
Okay.
So you really want to wait until the child is 3 years old to implement any type of fluoride toothpaste. And you want to start with very small smear layers of toothpaste or pea-sized amounts of toothpaste. And there are special toothbrushes that are for children. You also want to make a toddler's oral hygiene regimen at home fun. Implement fun stories, cartoons, reward them with stickers. Make it a playful and a fun experience so that when they go to the dental office, they're excited and they're looking forward to everything. Now, the implementation of fluoride into the oral hygiene regimen is really an important thing because it's helping the outer layer of the tooth called the enamel stay strong and resilient towards the changes in pH and other changes that will happen over the years in a person's body. So as we transition from the toddler years towards more of the teenage and young adult years, you'll start to see the baby teeth come out of the mouth, and there should be 20 of them. And you'll get your new set of 28 to 32 teeth in the mouth. And many parents' first question for a child when they turn 8 or 9 is, well, does my kid need braces? Yeah. And most children these days do need braces. But braces comes with a whole different set of responsibilities. So these teenagers, these young adults, they really have to have, like I said before, strong oral hygiene habits because food can get stuck into braces. And there are new technologies called clear aligners, which patients can go and speak to their general dentist about or get a referral to an orthodontist. And these modalities help fix spacing, crowding, any misalignments in the teeth so that they're easier to clean. So this is really the big issue that kind of comes across in that part of the developmental phase. And this is when you'll also change your toothbrush. You want to move to a more bristled toothbrush, and of course you want to stick to a soft bristled toothbrush. And braces is when you want to also kind of implement a water irrigation system that flossing may not get between braces, so this will, and it'll be a good thing for the kid to have to prevent the teeth from changing colors or developing cavities. Now, as you move into the adult years, you know, the jaw changes that happen may bring up other issues like wisdom tooth problems. And you know, as we talk about in our last segment about the oral surgery specialty, I can definitely go into more detail with that. And then in the senior years, when you start losing the teeth, it has a whole other slew of wonderful things that come along with it, but also many questions like dentures, implants, what's better for me, and we can elaborate more on that for sure.
We'll take a quick break, and when we come back, we'll be talking to Dr. Hemali Ajmera on oral hygiene as well as controversies over amalgam fillings and bondings. Stay with us.
Your Health Matters with Renee.
Welcome back to Your Health Matters. Today we're talking to Hemali Ajmera. Dr. Ajmera, tell us the importance of oral hygiene.
So oral hygiene is very important because there is a clear link now between the oral cavity and your overall health and well-being, and vice versa. The oral cavity can be used to diagnose many systemic diseases, and systemic diseases manifest themselves by the oral cavity. So you have many issues like blood pressure,
Yes.
diabetes,
Cardiac issues.
Arthritic issues that go on with the bones that really you can diagnose with any kind of gum changes, levels of the bone that change. So why the oral cavity? Well, it's the portal of entry for many different things like food, beverages, germs. And so we want to make sure the oral cavity
Is it
stays
genetic?
clean. So you're going to have an interplay of both genetics and environmental factors, but environmental factors can be controlled.
Yeah.
And because you can control those, you can actually keep any genetic tendencies in check. So oral hygiene becomes important because you want to make sure your mouth is pH balanced. You want to make sure you're flossing every day, you're brushing twice a day, and that's of course the guideline for the American Dental Association. For the elderly who may have difficulty flossing and brushing because of arthritic issues or because they have implants, they have dentures, they may have oral cancer issues with their age, you want to make sure that you are using every modality you have. Floss threaders, proxy brushes, oral irrigation systems, electric toothbrushes, seeing the dentist 3 to 4 times a year instead of just twice. And, really being more diligent, because in your older years, you need more care, you need more attention, and you may not be able to do all of that yourself, even if you have the time. So that's what we're really here for. Other things that can be plaque traps, and we may not even know it, like we spoke about with young adults, they're doing sports or they have braces. So you want to make sure those appliances that go in the mouth come out, they're cleaned, make sure a parent is overlooking it so that, there's not any kind of bacterial growth in the back areas. In, the 20s and 30s, the wisdom teeth become a problem where they're coming out. They're not as cleansable because they're in the back of your mouth. There's gum tissue over the teeth. So, the various different phases have various different needs. And there's more development in that area because we're more aware now. It's not just like, oh, doc, I have a problem. Can you just pull my tooth out? We know better than that now. We want to save teeth and we want to prevent the teeth from having disease in the first place.
So there's a lot of controversy and debate over amalgam and mercury fillings and tooth color bondings. What's your take on that?
So I think both types of fillings or both types of treatment modalities have their pros and cons. Silver fillings are very strong. Silver fillings can be placed in places where the mouth is not dry and there could be saliva. It's better at taking harsh biting forces. However, like you said, it's not ideal to have this mercury in the mouth or going into the body. During placement, you want to make sure that a protective umbrella is put on the tooth called a rubber dam to prevent any of that amalgam from going into the system. During the time of replacement, you want to make sure that there's a suction or an assistant there to capture all of the material that's being removed. I'm not a fan of silver fillings, but they do have a place in the industry and you will still continue to see them because we have the aging population that's still with us.
So
Now,
you have to know who qualifies for it and probably get a second opinion.
Exactly. With tooth-colored fillings, there have been so many technological advancements, and those white tooth-colored fillings, or bondings as I like to call them, really have taken over the cosmetic dentistry arena and the general dentistry arena because there are 16 to 32 different shades by each brand. We can really match teeth perfectly. We now know that the outer shell, the enamel, has one color, the shell underneath, the dentin has another color, and the pulp has its own color. And from the top to the bottom of the tooth, it can vary in thickness.
Really?
So one, tooth can have 2, 3, 4 variations of tooth color and anatomy. So, as we have developed that market, we can now do things with bondings that we could never do with silver fillings. And that's why we can save teeth. There are also bondings which capture fluoride from the oral cavity and put it back into the tooth. However, white fillings are very technique sensitive. The tooth has to be dried. After the tooth is prepared or cut and the cavity is removed, it needs to be cleansed properly, and the materials really have to seal around the tooth carefully because if not, you get micro leakage.
I see. And that can cause?
Recurrent decay or can cause the decay to happen again. But there are things like baby bottle tooth caries, which we now know a lot of moms keep the bottle in the baby's mouth. And those dark spots that happen on the front teeth, we don't have to take those teeth out anymore because we have tooth colored fillings. So we can really help to fight those things that we normally before would have to say, let's take the tooth out or put in silver diamine treatment and it changes the tooth and makes it black.
Right. And how long do these bondings last?
Bondings last as long as you take care of them, is what I like to say. And your teeth are similar to a car in many, many ways. They get a lot of wear and tear, different environmental issues. There's water in the mouth, there's food in the mouth, there's function going on. It's really about maintenance. So there's no real guarantee, but you can increase the longevity over the years.
What about the teeth whitening creams? Are they safe? Is something toxic about them?
Teeth whitening is an explosive arena in dentistry. It has really started with a basic one or two brand situation to now dozens of brands. There are whitening lights, there are whitening creams, whitening toothpaste, whitening mouth rinses, you name it. It's just an entire branch on its own. Why do I like teeth whitening? The majority of patients that come in just want to brighten their smile. They want to go back to the color it was before they had their daily red wine, their daily coffee, their daily food. And that's really where teeth whitening comes to light, is that you can schedule a 1-hour visit. It's pain-free, very little amounts of post-op sensitivity now because it's so advanced. And I'm a very big proponent of teeth whitening because it's our most conservative form of cosmetic dentistry.
And it's safe.
It's
and
very
it's toxic.
safe.
It's not toxic.
As long as you're using the formulations that are safe to use at home, it is. Now, one thing I like to say is with the toothpaste, you have to be a little careful because they have abrasives. And you want to make sure those abrasives don't scratch the teeth.
That is important. So we'll take a quick break and we'll be back in just a moment and talk to Dr. Ajmera about cosmetic dentistry and other specialties. Stay with us. We're back and talking to Dr. Hemali Ajmera, who serves on the Board of Trustees of the Queens County Dental Society. Let's talk about cosmetic dentistry. I'm sure a lot of viewers would like to know about that.
Cosmetic dentistry has always been a hot topic and it continues to be. And the reason being, everyone wants to smile confidently.
Of course. And now you can customize your smile. That's the most important thing.
You absolutely can. The latest technologies allow a patient on a screen before even sitting down in the chair for any treatment to just see their smile transform on a computer in front of their face. Right. And there are ways to do this now pain-free. We talked about teeth whitening. We have laminates or lumineers. We have veneers. We have white crowns. All types of different technologies now that really, in 2 visits, patients can transform their smiles. When you transform an entire smile, you actually don't just change the front of the smile, you change the entire face. You change the cheeks, which can get raised and give you a younger appearance. You can bring out someone's eye color with whiter teeth, or just transform their hair or anything. It's called cosmetic dentistry for a reason, and it's really come a long way. And like I mentioned, it's pain-free in many ways now because there are ways to now bond to the outer layer of the tooth without drilling too much. So in line with veneers and crowns that are tooth colored, we now also have implant technology, which has come such a long way. Before, you needed tremendous amounts of bone, you needed such heavy surgical, equipment to do all of these things. Now
it's ready to get on the dentist chair.
Exactly. It's an in and out visit. We have shorter implants, and there are even dozens of brands of implants out there now. So once you consult your dentist and your oral surgeon, you can really move forward with so many varieties of cosmetic dentistry. And like we spoke about in the last segment, we have bondings, tooth color fillings. And there are now even milling machines where you can do same-day crowns. where you just take a digital scanner or an intraoral scanner, and there are many, many brands of that also, and you can mill a crown in a visit. The patient has to wait a few hours and then they go home with their crown on their tooth.
Interesting.
It is phenomenal. It's phenomenal, and really the trend is towards conservative dentistry. We have gone from a place where we needed to pull an unhealthy tooth to drilling it, to now it's like, you know, you're saving teeth right then and there. There's no chance for disease to progress.
That's wonderful.
It's
And then
just
there's
wonderful.
Emotional dentistry.
Sure.
Takes the phobia out.
Sure. The more we do conservative dentistry, which is, you know, preventative or cosmetic, what you're doing is you're taking the fear out of the dental visit. Once upon a time, the patient came in and there was no anesthesia, or there were massive surgical procedures being done that instilled fear. And you know, that really happens early on with children, or a bad experience having a tooth pulled, and then that's it. You don't want to go back. Now it's changing. People have more pleasant dental visits. There are dental spas, there are dental boutiques. We have implemented aromatherapy, surround sound. You can listen to your favorite song when you're having your teeth drilled, so you don't have to hear the sounds. You can watch your favorite TV show. We've come a long way. I'm very proud that the industry has really moved towards reducing the level of fear. And of course, there are medications, and we try not to use those as much, but to help really anxious patients get relaxed. And a lot of patients have high stress on a day-to-day basis. Those patients, they come in, they're gonna have joint pain, they're gonna need night guards, and they're gonna need a little bit more monitoring. And we have the technologies to do that too, so that they don't come to us when the tooth is ground down to the level of the gum. And when you come into that level, it's a very scary thing. You're opening up the bite, and you're now just affecting the entire face, not just the teeth. So I think that I want to say that yes, there is a lot of phobia because there's so much loss of control when you're in the dental chair. But I think the industry has done so much to help counter that, you know, and it's a good feeling to provide dental care to a patient who is a willing patient.
Absolutely, absolutely. And you have other specialties as well. Let's talk about them as well.
Sure. I'd like to expose a little bit of information about each arena of dentistry because I think they all tie in very well together. And the trend is really towards having one of each specialist within the office now. So I like to start with periodontal care. And the reason I like to start with periodontal care is because it's similar to the foundation of a house. You can't have the house on a weak foundation. So the periodontal care is having the gum level and the bone level be healthy, have the attachment, which is what's keeping the tooth in the bone and the gums healthy and monitored and clean. So periodontal health is what really is the crux of everything we do. You can do a root canal on a tooth, but if that tooth is free floating, you've lost the tooth.
Exactly.
So periodontal care is the first thing that I think is the most important and is something that pertains to everyone. And there are measurements we take to make sure that those are all healthy levels. There are different rinses that we give the patient, antibiotic rinses, and you know, it's just something that we have progressed in that area, and we can help patients in the office and at home. After periodontal care, I like to talk about endodontics, the dreaded root canal.
Yes, that is scary.
Why is that so scary? Because many patients who need a root canal come to us by the time it's too late. They've missed their 6-month cleanings over and over again. They haven't been pH balancing their mouth between visits and day to day. The root canal is really a great conservative way to keep your healthy, natural tooth in your mouth. There's nothing like your own natural tooth. You want to clean out that disease, you want to seal it up really well, and then get a cap or a crown put onto that tooth that's been treated.
Take 2 visits?
Usually a root canal can be done in 1 to 2 visits, and then the crown can be done either in 1 to 2 visits, but that really goes hand in hand. Prosthodontics and cosmetic dentistry are what we know as your routine dentistry, your cleanings, your fillings, your bondings, and these are really what people are familiar with. When you go in to see a dentist, you'll say, oh, I broke this tooth, I did this, I did that, I need my bite opened a little bit, I need my smile improved. Yeah. So that's another very routine form of dentistry. Oral surgery is also another one that's feared, just like endodontics. Yes. And the fear has now come out of it because the technology is there. We have cone beam scans, we have surgical implants, and these technologies are in office, you have the procedure done, you go to work. So it's not how it used to be before. And then there's pediatric dentistry. I would say that if you are a parent and you can't make your way to a general dentist, and they will help give you fluoride treatments, they will guide you for any other things that you need for your child. So I think that this was a comprehensive and general look at why dentistry is so important and why patients should see their dentist every 6 months, the way they see their physician annually. Absolutely. Cannot understate the importance of good oral hygiene and cultivating a great relationship with your dentist.
Thank you very much. And I think the most important takeaway is, of course, oral health is very important because the whole body rests on that. So visit your dentist every 6 months at least and brush your teeth regularly. That is very important. And thank you so much, Dr. Hemali Ajmera, for all these great insights into oral health. And I'm Renee Mehrra. Thank you for watching Your Health Matters. Stay healthy, stay positive.